Last long weekend of the summer may be over, but the potential impact on local COVID cases is only beginning. So here to answer your questions about that and more is Dr. Todd Halloran, Chief of Infectious Diseases at South Shore Health. Dr. T, it's always great to see you. Thanks for joining us.
Hi, Doctor. We've seen surges after holidays before. So if Labor Day triggers a spike, how soon would you expect to see the first signs?
Right, Maria. And, last year we were in a very different place. There were about 32,000 cases a day. This year, there's about 139,000 cases a day. So a significant difference. Generally, as you know, symptoms start within 4 to 7 days later. Hospitalizations usually about a week. So it takes about a couple of weeks before we get the data that there's increased hospitalizations, et cetera.
Speaking of data, Dr. T, the White House now says that 75% of adults here in the United States have received at least one dose of the COVID vaccine, and they define an adult as 18 years of age or older. So how do Massachusetts and other New England states compare?
I mean, we're kind of kicking butt in this regard, Ed. We're doing about 10 to 25% better than the other states in New England, depending on where you are. Massachusetts is number 2 in the country. We're doing really well.
So we always knew that there would be a percentage of adults, Doctor, who would never get vaccinated no matter what. So do you think that we're seeing that number now? Is that showing itself right now?
I am not giving up on us, and I hope you don't either. I was on call over the weekend, and I saw too many patients coming with severe and critical disease. And I'm not talking about just the elderly. We have 30-year-old pregnant females with severe disease. We had a 30-year-old, another female that was so critical, we had to paralyze, intubate her, and we need to, and all of them are unvaccinated.
I was just going to ask you, were they breakthroughs or were, okay.
All unvaccinated.
Some people who have had COVID say that they don't need a vaccine because they've already had COVID. I don't need a vaccine too. So is that true? And does natural immunity offer enough protection from the Delta variant?
Right. So a study just came out from Israel that did show that the patients who basically had been infected before with the virus were at decreased risk of getting Delta infection compared to patients who are fully vaccinated, about 13 times less likely to get that. But here's a big but.
Yep.
If you were previously infected and got one dose of the vaccine, those were the patients that were least likely to get it. So listen, if you've gotten infected before, especially with Delta, you are you are protected, but still adding vaccine above and beyond that is still the way to go. Now remember, in this study, they didn't talk about boosters, so no one had gotten the third dose. But I do think it tells us in the future, for the next generation vaccine, it may be an improved vaccine that has that Delta signature, that gene sequence, that's going to be even better. So I think that there is going to be improvement in the future based on this study.
Dr. T, it's always great to see you. Thank you for your time.
Be well, Doctor.
Take care.
Thanks, Doctor. First Lady.